I'm back for Whiteboard Wednesday for October. October is Dental Hygiene Month, and this month we're going to talk about your overall oral hygiene with braces on. When you're in ortho, it's really important to keep them really clean. So I'm just going to talk about a couple things that you can do that me and the other hygienists recommend while you're in braces, and I'm going to let Danielle ask you questions and I'll answer them for you. Okay, so just brushing your teeth is not enough. You still need to see a dental hygienist and get them cleaned while you're in ortho because it's very important. It's easier to build up plaque and bacteria around the brackets, so it's urgent that you have your hygienist clean your teeth while you're in ortho and almost be on a more frequent recall so we can check on things and clean them more frequently. Usually people are on a 6-month recall, so they come to us twice a year. Some patients, while they're in braces, will come every 3 or 4 months just to get them cleaned more frequently. But it's just important to get them cleaned while you're in ortho because the brackets make it harder to get food debris out of your teeth and in between. So we go in and we clean them really good and get the brackets really clean so nothing sits on your teeth longer than it should. It is not too hard for us to get around. It is a little more difficult. We use a little instrument with water and we clean around the brackets, and we still use our hand instruments, and we sometimes use it's called a Profi jet, and that helps basically sandblast the bacteria off of the brackets and off of the teeth, and it also removes stains. So it gets all of it. It's not too hard. We do it all the time. Okay, so if you don't get your teeth cleaned regularly while you're in ortho or you don't have good home care, it's much easier to have decay. So you can have cavities in spots that you wouldn't normally have them, a lot more staining, and demineralization happens, which causes white spots on your teeth, which means that there has been too much acidic food or bacteria sitting on your teeth too long, and those white spots do not go away after your braces are taken off. And it makes your teeth more susceptible to bacteria and cavities. So the best at-home tools, we all recommend a water pick for sure, because the water pick helps get the bacteria out in between the brackets, and we also highly recommend an electric toothbrush. It doesn't matter if you're in ortho or not, the electric toothbrush is really good to have while you're in ortho. It helps keep them very clean, and the motion of the brush, and it gets the whole tooth and it should get stuff off the brackets. A couple of other things that I also recommend while you're in ortho is using they look like little Christmas trees. They're called inner dental brushes, and they're just little brushes, and you can put them in between each tooth and you can remove bacteria that way from the brackets. And also, people think that you cannot floss while you're in braces. Not true. There are floss threaders that use floss thread, literally like a needle, thread and needle, through the brackets, and you can floss that way, which is really important because you can't not floss the whole time you're in ortho. It's not good because you could have cavities in between the teeth. So really, flossing, water pick, electric toothbrush, and even a fluoride mouthwash is what we highly recommend while you're in ortho. We cannot. That is the orthodontist's job. So we don't like to fix or touch anything. That's their specialty. So if we see something broken or you call us and there's something's broken, we will just refer you to your orthodontist to have them fix it. Just a big one is flossing. If you ever get braces on or you get your braces off and you have the fixed lingual retainer at the bottom, which means you just have them on the bottom teeth and sometimes you have them on the top, just on like the front 4 or front 6. The floss threaders, they really need to be used to remove the bacteria in between the teeth. The water pick does not just remove it in between the teeth. The water pick is an adjunct to flossing, so you need to technically use both flossing and the water pick. And if you have the ortho retainer on that's fixed, you need to have someone teach you how to floss underneath that retainer also, because a lot of people just don't floss under there because they think they don't have to because that's right there. but it's really important that you do that because letting that build up right there can cause bone loss, inflammation, and calculus builds up right there most commonly. So just ask your hygienist or your dentist how to floss with braces or with a fixed lingual retainer. The biggest thing that I want patients to do while they're in braces is just focus on keeping them clean, because usually people go into braces for cosmetic reasons, so they want their teeth to be straight and look really good and healthy, but if you don't keep them clean while you're in ortho, they're not going to look healthy once you get them off, and your gums will be very swollen, they'll be very uncomfortable. So if you really keep up with your hygiene, it may seem like it takes forever at night and in the morning, just do it, because once you get your braces off, your teeth won't have the white spot lesions, your gums won't be inflamed, and it won't be uncomfortable, and your orthodontist and your dentist, your dental hygienist will all be very, very happy. It's just really important. Some orthodontists will even take off your braces if you're not taking care of your teeth and doing home care. So just keep on brushing. If you have any questions, message us or ask your hygienist or your dentist. Okay guys, this will be our last Whiteboard Wednesday this year. So thank you for watching and joining us this whole year for our Whiteboard Wednesdays. And write your comments and subscribe to our videos. We've enjoyed teaching you, and so just comment or message us if you want to hear from us. Bye guys!